folks. Good evening. This is Mary Sue Lanigan. I'm the Executive Director at the Michigan Parkinson Foundation, and I want to welcome you all this evening. This is our Tuesday night regular virtual support group. I am delighted that we have Andrea Thomas. She is a speech-language pathologist with the Recovery Project. They are a wonderful rehab and therapy facility. Great programs for people with Parkinson. She is going to do a program on Speak Out. It's a practical approach to treating speech and voice issues in individuals with Parkinson's disease. So I give you Andrea Thomas from the Recovery Project. I ask that you all hold your questions until the end of the evening, and we will unmute you at the end of the evening so that you can ask those questions. Welcome, Andrea.
Thank you. That was quite an introduction. Love that. Okay, so I am going to bring up my presentation for you guys. So bear with me while I share my screen. Okay. Am I good?
Yeah, you're good. Great.
All right. Okay, so again, I'm here to talk about Speak Out and Loud Crowd as a dual treatment, and we'll get to that a little bit later. But I'm basically going to talk to you, give just a little bit of history about it and how it got started. I'm going to tell you how it works and how you could get involved. And hopefully you guys will have a lot of questions for me because I did save quite a bit of time for that because I know things will pop up and you'll have questions. I'm hoping you'll have some good ones for me. So let's go ahead and get started. So Speak Out was developed by Samantha Landry, and she started the Parkinson's Voice Project. Samantha actually worked with patients back in the 1990s in just her living room and read a book written by Daniel R. Boone, and he applied those concepts and his research to her patients, a modified version, so not exactly what he wrote about in his book. And it gained such popularity, and she saw such good progress with her patients that she was able to actually move out of her living room with donations and start her own clinic. So the Parkinson's Voice Project is in Richardson, Texas currently, and it's the only nonprofit organization in the world dedicating to helping people with Parkinson's improve their speech, voice, and swallowing. And she had such success with it and continues to have success with it that she created a certification program, which is why I'm here, so that it could be offered to Parkinson's patients throughout the country. And I just wrote Speak Out and Loud Crowd research here because it gained a lot of attention. A lot of independent researchers actually studied Speak Out themselves and did find it to be very efficacious and helpful to people with Parkinson's. Which I thought was interesting. I can also show you on their webpage later on because they have an excellent webpage, a lot of the studies that were done and things like that. So this is just a little bit of a background. So how does Speak Out work? So I'm going to do my explanation of it, and then I'm going to play a little part of the video because I think they also explain it very well. So this is kind of like the science behind why it works. So as you all know, or probably know, Parkinson's is caused by low levels of the neurotransmitter dopamine. The symptoms are caused by that. And the low levels of dopamine particularly affect the automatic functions. So automatic functions are things like your walking, blinking, talking, and swallowing. Luckily, there are two motor systems in our body. There's the extrapyramidal motor system and there's the pyramidal motor system. The extrapyramidal motor system does not work well in individuals with individuals with Parkinson's because it relies on dopamine. So the extrapyramidal system is responsible for all of our automatic functions. So think automatic functions, so the things like walking, talking, swallowing, extrapyramidal system. The pyramidal system, however, is responsible for our non-automatic functions. So it does not rely on dopamine. So non-automatic functions might be the effort that you need to learn how to play an instrument, exercising, anything that you do that you have to think about, pretty much. So the speak out premise is we're going to train people to bypass the extrapyramidal system and use the pyramidal system, which does work well in people with Parkinson's. I'm going to play you the short video to kind of explain it a little bit better. And wait for it.
Talking and writing. However, there is some good news. People with Parkinson's can control some of their movements with one simple concept: intent. You see, humans have two basic motor systems that control movement: the extrapyramidal system and the pyramidal system. The extrapyramidal system is responsible for movements we perform automatically without conscious effort, such as blinking, swallowing, and swinging our arms when we walk. The pyramidal system, on the other hand, is responsible for intentional movements, purposeful movements, such as putting on makeup, shaving, or learning to play the piano. Here are some simplified drawings of the brain that show the differences between the two motor systems. Impulses travel from the cortex down to the brainstem and spinal cord. Both motor systems end in the same place, but it's how they reach their final destination that makes them different. In the extrapyramidal system, there's a complex network of neural fibers that stop at various structures within the brain, including the substantia nigra, where dopamine is produced. Think of the extrapyramidal system as a country road that has extra stops along its path. Without enough dopamine, the extrapyramidal system doesn't work very well. This is why automatic movements are disrupted in Parkinson's. But in the pyramidal system, the neural fibers travel straight down without stopping. Think of the pyramidal system as an expressway. Since the neural fibers don't stop to communicate with other structures, this motor system works better for people with Parkinson's. Intentional and deliberate movements are preserved. We activate the pyramidal system when we consciously and purposefully produce a movement. When people with Parkinson's use intent, their speech sounds clearer, they stand up straighter, and their handwriting becomes more legible. All of us have used intent throughout our lives. Think about a past job interview. Did you make a conscious effort to smile and make good eye contact? Did you purposefully stand up straight and speak clearly? You were using intent. Have you ever been driving when suddenly you get caught in a downpour? Did you turn off the radio and put both hands on the wheel? You were using intent. What about when you exercise? Do you work hard to swing your arms, lift your knees higher? Do sit-ups or push-ups with more effort? This is intent. At Parkinson Voice Project, we encourage...
So I'm going to encourage you guys to watch this entire video at some point. I'll show you how to get to it, but it's really, really good and has a lot of good information. We'll refer back to it again in a second. Okay, so let me go back to my video, or my PowerPoint, excuse me. Getting kind of good at this. Okay, so basically a catchphrase of Speak Out is speak with intent and live with intent, and my job as a Speak Out certified therapist is to teach you all how to do that. So we'll move on to the next slide, which talks about if you wanted to try Speak Out, how you would get involved with it, and then also what it entails. So when I see people come to me with Parkinson's, it's usually for a handful of reasons. So the main things are a soft voice. So people I see might say, my spouse can't hear me. People always ask me to repeat myself when I'm speaking face to face with them. No one can hear me in a restaurant. I have people come to see me with slurred speech. So maybe the speech is just not very clear. And I have some people come to me and those symptoms come and go. Sometimes they speak wonderfully, and sometimes, like for example, when they're more fatigued or late at night, they have more difficulty. I also have people who come to see me for swallowing. So they have the sensation of things getting stuck in their throat, or maybe they've had actual choking episodes. And then sometimes people come who have Parkinson's who aren't showing any symptoms, and they just want to be evaluated and want to get ahead of the game. So want to learn these strategies now rather than later, so that they'll know what to do if the symptoms do show up. So in any of these cases, the first thing that these individuals need are a script from the doctor, and it doesn't have to say Speak Out. All it has to say is speech therapy, evaluation, and treat. That's it. It doesn't have to be specific to Speak Out. So I just wanted to make sure that was clear. And then when you come in for your evaluation, I'm going to be honest with you and let you know if I think Speak Out can help you. And if I think that it will, I will give you some information. I'll give you the Parkinson's Voice Project number and some information you can give them. And they will send you a Speak Out workbook, which I'll show you guys in a second. That's provided by the Parkinson's Voice Project at no cost. So, I mean, how cool is that? You get all of your therapy materials for free. Let me actually show that to you now. Well, no, I'll go to that in a second. So you get your workbook, and you're going to bring it to your therapy session every time I see you. And you can expect to work, if you're in Speak Out with me, for 2 to 3 days a week. I prefer 3 days, but it depends on insurance. So especially with you know, the Parkinson's diagnosis, there's a lot of other things going on. So if you're on Medicare, I know that you'll need physical therapy too. So usually I'll go the route of 2 days a week for those people to kind of save benefits for both. But most people I see are finished with Speak Out in 12 individual speech therapy sessions. There is the occasional case where somebody needs a little bit of extra time and we can go beyond the 12. It's not like you get to 12 therapy sessions and no matter what, you're done. But just on average, usually people are in the therapy for about 12 sessions. So if you're doing it 2 days a week, 6 weeks. And then sessions are anywhere from 30 to 60 minutes in length, okay? So let me show you the workbook now. And you'll see what I'm talking about with what's entailed as far as a lesson daily. So let's see, not sharing again. And wait for it, guys. Okay. Okay, I pulled it up, but it would help if I showed it to you. Okay, so here's what the workbook looks like. You would get your own hard copy. It wouldn't be digital. So I know that everyone likes having their book in front of them, but it's really cool. So let me move it so I can, okay. So you'd bring this with you every time. You know, the beginning when you flip through, it tells you a little bit about Samantha, who I mentioned earlier, the one who founded it. And then Daniel Boone, I also mentioned him. There's some information about him. But what I like about this is they make it so easy. There's no guesswork about what you need to do to be successful. Everything's kind of laid out for you. So each week you'll have carryover tasks. So these are things that you will be expected to do, not in the therapy session, that will kind of help you think about your speech or your swallowing outside of working with me. Excuse me. And then each time you see me, we'll go through a lesson together, and then you'll be assigned lessons that'll be clearly laid out for you. And each lesson has the same kind of format. So when you start it, you have 3 voice exercises that you do, and these are pretty standard for each lesson because they work and they're very helpful. And then there is a counting exercise. So once, or if I see you in therapy, I'll explain to you the purpose of the counting, but this is pretty standard with each lesson. But then each lesson has some functional reading. So instead of doing just the voice exercises, you're going to be practicing the strategy while you're actually speaking. And then one thing I really like is that each lesson has a cognitive portion to it. And this is to make sure that, okay, if I add cognitive load to this activity, can you still maintain your speech strategies? So each lesson is like this. You have a new reading activity, and the workbook goes from beginner to more advanced. So you'll start out in the things, and the readings will be pretty easy, and then as you get better and more comfortable with the exercises, it'll get more advanced. So that's the workbook, and you would get it completely free. Pretty cool, huh? Okay. Let's go back to the PowerPoint. I got off track a little bit. And actually, let's go back to, I go over everything here. Yeah, you did all that. So let's see some actual videos of people who have gone through the treatment. And okay. All right, I'm gonna play it. It's free, guys.
Here's an example of someone who completed Speak Out.
Have you noticed a change in your voice or speech?
Yes, I have.
What have you noticed?
It's much softer and more difficult to speak. I speak louder, clearer, and with intent.
Here's another example of progress that can be achieved through Speak Out.
Have you noticed a change in your voice or speech?
Yes.
What have you noticed?
Well, often when I'm fatigued, I can hardly talk loud. So I'm louder, I'm more confident, I speak with purpose, and I'm conscious of what I'm saying.
Many of the muscles we use for speaking are also used for swallowing. So speech therapy isn't just about improving one's communication skills.
Well, the voice is getting weaker, but my big problem was swallowing. I had a couple of episodes that were near death, actually. The one I remember specifically is my wife was out of town, and I was having sandwich at the lunch table there at our house, and took a piece of sandwich, and it didn't go down. And so it stopped, and I stopped, couldn't breathe. And I can remember thinking, I said, what a ridiculous way to die, choking on a tuna fish sandwich. Well, I can tell you that before the program, I would notice stuff would get a little stuck, and it would eventually go down, but there was a problem with actually carrying through the swallowing motion. And after the program, I just swallow like a normal person. I don't even think about it anymore. Of course, I'm fairly religious about doing my exercises.
Something
So you're probably thinking, what's the catch? I'll get to that. Pretty cool though, huh? Okay. So what's the catch? There actually is a catch. And it's because the goal for speech therapy for an individual with Parkinson's is different than the goal for speech therapy for traditional speech therapy. So for example, let's take speech therapists work with kids. So let's say I don't, but some do. But let's take the speech therapy with a kid for an example. So let's say a kid was seeing a speech therapist for a particular speech sound. Maybe he had some sort of speech impediment. The speech therapist would probably work with him for about 6 to 8 weeks and then fix the speech sound and then discharge the child and possibly never see them again. That's not the case with speech therapy for individuals with Parkinson's, because as you guys know, it's a gradual progression of symptoms. So speech in individuals with Parkinson's will never be automatic. It's something that you all will always have to work on and be intentful and purposeful with. So ongoing practice is definitely required if you want to maintain your progress and not regress, or keep your progress from speak out, which brings us to the loud crowd. So I said earlier that this is a 2-part treatment. The speak out portion is the treatment. That's where you're going to figure out what the problem is and then develop strategies to overcome it. And then the loud crowd is developed to help give you some motivation to maintain. So it's a 1 time per week group therapy. It offers, accountability. So, you know that you're going to have to practice this day. It offers you camaraderie because you're going to be able to meet other people who have also gone through speak out and kind of know what you're going through, support and education. And I will show you part of that video again, just to kind of give you guys an idea of what it looks like. Because I know when I first heard about it, I couldn't really picture it. So this video again kind of shows the loud crowd sitting together. So let me show you that. And then I'll talk to you about a little bit about the loud crowd we have started at the Recovery Project. I keep forgetting to share it. That's important. Okay.
Every day, and will always have to be intentional about speaking. This is where the second part of Parkinson Voice Project's therapy program comes in, the Loud Crowd. The Loud Crowd is a maintenance program that consists of daily exercises, weekly speech groups, and regular follow-ups every 3 to 6 months. Some people might be reluctant to attend group therapy at first. However, these groups provide support, encouragement, and valuable education to both patients and their families, in addition to ongoing instruction by a speak-out trained speech-language pathologist. At Parkinson Voice Project, the Loud Crowd.
Okay. The Parkinson's Voice Project also has a loud crowd choir. We don't have that yet, but that's the dream, right? To have a choir. All right. So, bringing the PowerPoint up again. So the Recovery Project just now, actually starting this week, has their loud crowd virtually starting. My big dream was to have it, in person, where everyone can see each other and talk freely and not have to worry. But it is what it is. So we're virtual now, and it's part of the Recovery Project's virtual wellness program, which I'll tell you guys a little bit about if you're interested in. But the important thing to know is you must complete speak out before you do loud crowd. So I want to make sure that the loud crowd's supposed to be nice and smooth. So there shouldn't be anyone in there who doesn't know the exercises or who needs a lot of help with them. Everyone should kind of know what to do and be able to support and help each other, rather than, you should just not need any help, basically. You should be able to know how to do the exercises pretty well. So that's the only thing, is the speak out is a prerequisite for the loud crowd. Let me show you a little bit about our virtual wellness program at the Recovery Project. I think it's really cool, and a lot of you might be interested in it if you're not already doing it. I'm going to pull up their website to help me explain it better. And then we can go to questions about anything I talked about. Okay, so to get to this, you're just going to go to the Recovery Project web page, and they have a little blue banner here that says join our virtual wellness classes. So you click here, and it gives you a little bit of information about it. It says our wellness membership program is run by therapists and rehab trainers with classes geared to meet the specific needs of our clients. So in addition to the loud crowd, the speech group, there is a ton of workout type classes that you guys would be interested in. So let me show you. I think if I go click to join, yeah, it'll show you. So each day has different classes. So there's the loud crowd, there's yoga, power moves, which is the class for people with Parkinson's of all, abilities. There's rock steady boxing. So all of these things are offered virtually, and you can participate in as many of them as you want a month, and it's for $50 a month. So it's a really, really cool thing to be able to do, especially now. I feel like you don't have to let the pandemic get in your way of progressing. You have this awesome tool right here that you could use. So I just wanted to show you that while I mentioned it. Oh, one last thing I want to show you, and then I can take questions. I wanted to show you the Parkinson's Voice Project webpage, because there's a ton of resources there that I think that you guys would like. Okay, so this is their webpage, and there's a whole section here for patients and families. So the things that I really like is there's more patient testimonials, so you can see more before and after pictures, or videos, which is really cool and motivating. There's the frequently asked questions, so if there's a question I don't answer for you today, there's a ton of them here. There's also practice videos, so I wouldn't try doing these without a speak out therapist kind of watching over you, but I have had instances in my patients who have a little bit of trouble with memory, have a hard time remembering the exercises, and they just logged on here and watched some videos, and it really helped them. There's also, they have a Facebook page that you can join, and it's really cool because it offers a lot of resources, other videos, and also camaraderie. You can meet other people who are also going through what you've gone through. So this is a really cool website that I want you guys to check out. And then the video that I was pulling from today is called the Parkinson's Information Session, and it's under education. And I really, really recommend watching that all the way through. It's about 15 minutes long. Okay. All right, does anyone have any questions for me? I know I kind of threw a lot at you.
Hang on, I'm going to unmute everybody in just a second.
Oh, people are muted.
Yeah, they are. Hang on. Okay, folks, I gave you all the ability to unmute yourself. So if you have a question, go ahead, unmute yourself. That little microphone that's next to your name, click on it, will unmute yourself, and you can ask Andrea a question.
Hi, Andrea. Great presentation, good information. I was wondering, do you know of any resources that are available in the Windsor, Ontario region?
That is a good question. So there is I think it's on the webpage too. You can seek out, if you go to the webpage, you can seek out therapists in your area that are certified. But one thing I forgot to mention also is that I do this a lot virtually with people too. So just because I'm not in your area doesn't mean you can't receive the therapy. So I'm a resource to you, and then you can also check out the website and see if there's somebody certified in your area if you'd like to see somebody in person. Does that answer your question or help at all?
Yeah, actually it does. It's good to know that your services are offered virtually too. So thank you.
Yeah, Andrea, how do you get started virtually?
How do you get started virtually? Okay. So where are you from?
Northern Michigan.
You're in Michigan? Okay.
Northern Michigan.
Northern Michigan rural area.
Okay, that's no problem. So you would just get a script from your doctor, and then you would have to fax the script to us, and you can call our clinic from our webpage and get all of that information. But all you need is a script, and they'll schedule it with you, and then I'll contact you. But we do it through a platform very similar to Zoom. So all you need is a script and give us a call.
Thank you.
Andrea, there are two options then. There's an in-person session that you can do or the virtual.
Yeah. So I'm seeing people in clinic right now and virtually. In clinic, it's a little interesting, I'm not gonna lie, because we have to wear face shields, and then we have a sneeze guard between us. But I've been doing it since March in person, and it actually works pretty well. It's just kind of getting used to the, face shield fogging up a little bit. But it really does work. Yeah, and it's been safe so far.
I would imagine you'd have to yell and speak a little louder behind your face mask, right?
Yeah, if anything, it just encourages people to work a little bit harder, which I'm okay with.
Yeah, okay.
That's a good question.
Do you have specific times?
Specific treatment times. That's a good question. I treat Monday through Friday, 9 to 5 Monday through Thursday, and then 8 to 4 on Fridays. So treatments will be scheduled in wherever I have openings. But usually people have, criteria for what works better for them. So when you call, you could say the morning works better for me, and then we'll wait to see who has an opening in the morning. I am a speech therapist at the Recovery Project, and there's 2 other therapists. So if you're doing virtually, you can have the pick between the 3 of us, and so you'd have more choices. But if you're coming into a clinic, it might be just a little bit more challenging to get a spot. But people do, we discharge people all the time, so we have openings pretty quickly.
Thank you.
Yeah, you're welcome.
Does the same speech therapist work with the client through all sessions, or do you all 3 interchange?
It depends on the situation. That's a really good question.
Yeah.
Good.
Yeah, that's a really good question. So in most cases, one therapist is working with the client. But what I mentioned earlier with people having certain times that work for them, sometimes we have to split the client up. But the really cool thing about the program is, as I showed you the workbook, there's just one way to do it. Right. So it's not one therapist doing one thing one way and another doing another way. It's a very standard approach. And so we haven't had any trouble with that yet. So that was a good question.
Is there going to be a follow-up email that gives us some of these references?
I would love to put that together for you. Is it Mary Sue? If you want to send that out.
Folks, we send out an email every single day, and we will send this information tomorrow morning. To kind of follow up with tonight's presentation, we are running the Living with Parkinson's series, and that they are meeting every Thursday at 1 o'clock, and we will also have a speech pathologist talking about the role of speech therapy, swallowing, speaking, a little more detailed than this, but we will send out all the information on the Voice Project, the Parkinson Voice Project, how to connect with the Respiratory Project. They have a great program. There's a few other Parkinson Voice Project grants around the state where they are also offering the same program. So I will send all that information out tomorrow, okay?
Okay.
Yeah, I've got a question. This isn't necessarily speech pathology related, but it might be. It has to do with communication. And our issue is one of selecting words, choosing the right word, as it's kind of a cognitive issue.
Forgetting words.
And forgetting words like Parkinson's. What do I have? I have Parkinson's, or
Right.
COVID.
Yeah, I'm glad you brought that up. I guess I didn't speak enough on that. That is a huge portion of a huge area that we work with. There is a cognitive component to the Speak Out program that does work on the word finding, memory issues and stuff like that. But also, it doesn't take very long, especially once you get good with the program, to get through those lessons. So a lot of the times we're getting through the lesson in about 20 minutes, and then we have, the rest of the hour, if needed, to do other types of structured or functional, cognitive exercise. So it's not necessarily a one size fit all. We kind of look at the client and see what they need. So if it's something where we can get through the lesson in 40 minutes and then they're feeling good and they can, go, or we can get through the lesson and then do some more cognitive exercise if the patient needs it.
Great.
Mm-hmm.
Okay.
Do you accept insurance?
Yep, we accept pretty much all insurances.
Where are the locations at that you have that you do the speech therapy?
We have a location in Livonia and one in Macomb, and then there's another one in Lansing. The exact addresses are on the webpage if you want me to show them to you.
That's all right, we can check that out. And then I had another question. For the sessions that are the $50 a month, are those virtual as well?
Those are, those are all virtual. So we started that once the pandemic happened and we had to stop all of our group classes. We wanted to offer something to our patients that they can pay out of pocket for. A lot of them go to it when they're out of their benefits for the year and they want, for PT or speech, and they want to keep up with, their exercise. So that is all virtual. And again, you can do as many or as little as you want. And you can cancel it at any time also.
Okay, and are those recorded, or is your speech therapy classes or sessions recorded? So that you could go back?
That's actually a good question. So I don't know what the standard has been so far. We're just starting the Loud Crowd this week. So I'm not sure if they're going to be recording them or not, but I can check on that, and that could be something else I add to the email of information that'll be sent out to you guys. I'm not sure if it's recorded.
Yeah, all the other, I'm not sure about hi, this is Heather Dupuy. I'm also from the Recovery Project. But all besides the Speak Loud, which Andrea will probably look into that, all the other classes that we do offer are always recorded. So that's what's so wonderful about our monthly wellness program, which we do have Rock Steady and Power and other exercise classes that would be appropriate for Parkinson's. Is we have a whole virtual library. So you can, if you're unable to attend that day and time of the session on the calendar that Andrea had shown you, if you work during the day or evenings or better, early morning, you can go to all the catalog of all the classes that we've already had up and running, and you can watch them as many times, anytime that you would like. So I'm sure as this program evolves, Andrea will also have those recorded for the Speak Out as well.
Oh man, I better not mess up. All right, any more questions?
Yes, Andrea, you're addressing speech and swallowing. Is the respiratory function addressed at all with this piece?
Yeah, a lot of the voice exercises actually help a lot with breath support and just breathing in general. And actually like breath control for speech too. So yeah, it is addressed.
Okay, all righty. One more thing, Andrea.
Sure.
How important, well, do you feel it's important to start these exercises prior to having concerns with Parkinson's?
I get this question a lot. I do. I feel like it's better to be proactive than, because sometimes what I've noticed is happening. I used to do LSVT loud, and so I have seen it a lot with that. But I prefer speak out now just because I feel like it's more functional and it's less grueling, and people, you know, are more likely to follow through with the exercises and things like that. But I feel like for a very long time, I've seen people come to me and it's almost like it's too late. I don't want to say that it's too late to get some progress, but I just wonder, oh my gosh, what would have happened if this person came to me and learned this stuff before any symptoms, you know, arose at all? Or what if this person came to me the first second, they were like, my voice doesn't normally sound like that, instead of just waiting until, you know, things got really, really severe. So I would say it's better to have more knowledge than not, and especially if you have the insurance that's going to pay for it, you might as well, you know, be proactive about it, learn what you need to do, and then it's, to me, it's less work later.
Okay. Thank you.
Yeah.
Any other questions?
How do I get the workbook again?
I wish I could just give it to you, but I feel like I would get in trouble. So you would get your workbook when you come in for your evaluation. So when you're evaluated by a speak out provider, they'll give you a phone number and some information to give the woman on the phone or a man on the phone, and they'll send you the workbook, and you usually get it within a week. They're quick about it.
Okay.
Yeah.
One more thing, Andrea. If you got, when you're involved with this, what is the time span at home that you're doing these practice exercises, your homework, I guess?
Yeah, that's a good question. Everything's outlined in the book. So that's really, really cool. Is the first thing it wants you to do is establish a home program routine. So keep in mind that you can get through lessons in 10 to 15 minutes, especially when you get good. Usually it's a struggle at first, but then people get the groove of it. But it's recommended morning and night.
I see.
Okay. For practice.
Thank you.
Yep, you're welcome. So really, if you think about it, 15 minutes in the morning, 15 minutes in the evening, that's 30 minutes of practice a day. Not a big deal.
Gotcha.
So have you ever recommended, you know, different instruments that would help them with breathing and lung capacity?
Yeah, there's some patients in different circumstances where I feel like they need a little bit more. And so one thing I usually recommend is the breather. Have you guys heard of that? No? You can look for it on Amazon. It's a really cool tool. It's an inspiratory, expiratory tool. It's just called the breather. And I actually have one myself because I have asthma and I like to exercise. And I feel like since I've been using it, it's really, really helped me. But basically it has a little dial on the side. I can actually even just show it to you guys really quick. And you can, it's kind of like weightlifting for your breath. You can set a resistance and you just basically breathe in and out with it on for a certain number of repetitions. And it challenges your breath support. I actually learned about this from a physical therapy conference I went to a while ago. And I was like, I'm going to try it for myself. And then I got it and loved it. So this is the one I have. Can you guys see it?
Yes.
Yeah, it looks like a little inhaler. And so it has little dials on the side. And, you know, one is the easiest resistance to 6. And what you want to be able to do is breathe into it without puffing your cheeks out. And another thing is you don't have to have a therapist to use it. They have really, really clear videos on exactly what you should do. So I think it's very user friendly if you guys want to try something right away.
Okay.
Okay.
Interesting.
And it's called the breather.
The
Okay.
breather.
All right. That's great.
Welcome. Any other
Okay.
questions?
Any other questions?
Thank you.
Welcome. Thanks, guys.
Thank you, Andrea.
Okay, Andrea, thank you so much. Everyone, I just put the Recovery Project's website into the chat box. So if you look at your chat box, the website is there. If you go to their website, all these programs are listed, the phone numbers of their different locations, okay? That's probably the easiest way to get in touch with them.
Got it.
All right.
Thanks, everyone.
Thank you.
Thank you.
Okay, folks. Remember, we've got exercise tomorrow morning at 10 a.m. We've got yoga at 10 tomorrow morning. Hope to see you.
Yep.
All right. Good night.
Thank you, Mary Sue.
Thank you. Good night.
Thank you. Thank you.